Hello, I'm Erica Klinger. I'm the Senior Director of Marketing at the Association for Accessible Medicines. I'm also the chair this year for the third annual Global Biosimilars Week, which is a social media campaign hosted by the International Generic and Biosimilar Medicines Association, or IGBA. And AAM and its Biosimilars Council collaborates with numerous organizations around the world in a united effort to raise awareness about biosimilar medicines. All week, we've actually been talking to patients and providers and regulators and other stakeholders in the global healthcare community. And today I'm here with Nell and Biehn from AmerisourceBergen, who I just met last week at the GRX Biosims conference. And AmerisourceBergen is an associate member of the Association of Accessible Medicines and its Biosimilars Council. And so really happy to have you. And I really thank you for chatting with us today.
Thanks for having us.
Thanks for having us.
So I'm going to kind of dive right into a few questions. And Biehn, I think I'll start with you, Biehn and Connor. So tell us a little bit about yourselves and the role you play in the generics and biosimilars industry.
Awesome. Well, thank you very much, Erica, for having us today. And thanks for hosting the AAM conference last week. It was a really great conference. So hi, everyone. My name is Biehn. I'm the Senior Director of Biosimilar Commercialization with AmerisourceBergen. We're part of our strategic global sourcing team. So our main role is working with our manufacturer partners to get access to these biosimilar products. So as we know, biosimilar products create cost savings to patients and access to patients that wouldn't have it otherwise. So our role is really working with the manufacturer partners to get those products in place for our downstream customers. So that being hospitals, pharmacies, clinics, anything like that. So we manage those relationships with those manufacturer partners. Connor?
Awesome. Yeah, thanks, Biehn. Erica, echo everything Biehn just mentioned. It was great to meet you last week, and fantastic job by the organization to put on a great conference. I learned a lot, and the networking opportunity was fantastic, and actually followed up with some of the folks we met while we were there, and are able to collaborate on a lot of great things. So my name is Nell. I'm Director of Biosimilar Commercialization at AmerisourceBergen. Similar role to Biehn, working with manufacturing partners to get AmerisourceBergen access to the products that our manufacturing partners are launching. Maybe I'll just shed a little bit of light on the education process that Biehn and I also focus on. So not just the acquisition and acquiring the products through our distribution channels, but also educating the downstream customers, helping our pharmacies and providers also educate their patients to really help increase the adoption of biosimilars for all of the ecosystem of the healthcare organization. So again, really appreciate the time today and the opportunity to talk a little bit about the things that AmerisourceBergen is doing.
Connor, I have one more follow-up question.
Sure.
What brought you to work in the industry, and why do you think it's important to expand patient access to biosimilar medicines?
So I have a little bit of a unique background. So I have been with AmerisourceBergen for 12 years. And I've spent most of my career working on the community and specialty pharmacy, retail pharmacy space. So in my previous life, I was helping independent pharmacies and working with pharmacy owners to attract, retain, and grow their business. And my more strategic customers in the last couple of years have really started asking me more about biosimilars and how they can grow their pharmacy and get more into that space. And I found myself asking more questions and digging in more with AmerisourceBergen leadership. And an opportunity came up for me to join the team about 9 months ago. And it's been an exciting whirlwind of 9 months as we prepare for what's coming and the things that have already happened in the biosimilar space. But learning from folks like Biehn and Melissa Latanzi and the other strategic global sourcing folks, it's really about the access and helping our patients continue to get, the products that they need. And one thing that I've learned from Biehn and the team and from other members of AAM is the additional days of care that biosimilars add. It's so important coming from independent pharmacy and working with independent pharmacists that are truly working on every single day to help their patients. Biosimilars do exactly that. So a little bit of a unique path, but super excited to be here and know that biosimilars have a way forward for patient care and for providers and pharmacies.
That what a really unique and interesting background. Yeah, we were just talking about to one of our patients, Eileen, who was talking about how she used a biosimilar to treat her Crohn's disease. She's in New York City. Biosimilars are used for rheumatoid arthritis and for cancer as well. So you're really important. They're really life-saving medicines. So I'm proud to work in the industry and proud to have members like you working with me. So shifting it over here, Brian, I have a question for you. I know that AmerisourceBergen recently issued a report about the biosimilars landscape in the U.S. So tell us more about this report.
Sure. As Connor touched on, one of the biggest things with biosimilars is education, right? And spreading the word of what biosimilars are. So the first biosimilar was launched in the U.S. back in 2015. So they're relatively young and new to the market. So one of the things that our team tries to provide for our downstream customers, again, either hospitals, pharmacies, clinics, things like that, and even patients, is a view of the biosimilar marketplace. So what this report does, we've been publishing it now for multiple years. But what it really does is breaks down the current market landscape to show you what biosimilar products are available, what therapeutic classes are they in. Like you mentioned, these are treating cancer patients with oncology. There's also immunology. We recently had a biosimilars in insulin, and ophthalmology just launched. So what this report does is really breaks down what products are available and what branded products do they reference. So it easily lets you see there's potentially, let's say, 5 different biosimilars for this one reference product, and patients could potentially use that product over the reference products, which hopefully is then driving cost savings down to them. And as Connor mentioned, definitely creating more ease of access to downstream patients. But not only does it look at the current market landscape and help our downstream customers, it also looks at what's up and coming. So there's multiple pages in the back of new therapeutic areas that biosimilars are launching into, reference products that are going to be coming off of patent, losing their exclusivity, and will then be susceptible to competition from biosimilars. So it's a good thing for our downstream customers as well to keep their eye on where is the biosimilar market going, where can they, again, see savings and see even more access for our downstream patients. Like I said, it's really just a great guide and education resource that not only our downstream patients, but a lot of the industry is using today.
Sounds like a great resource, especially as this industry evolves. I mean, just in the 6 years I've worked at AAM, I mean, now we're over 30 biosimilars approved, and it just keeps growing and rapidly. So really important resource. So Connor, is there anything else, any other unique efforts that you worked on related to building awareness about biosimilars? Can you share?
Yeah, absolutely. So one of the main pieces that we talked about is making sure that pharmacists, providers are aware of what the products are. So our pipeline report definitely goes into that. But Brian and I, with the SGS team and the global sourcing team here at AmerisourceBergen and some of our other subsidiary companies, have really tried to work on education from biosimilar 101 all the way down to condition tracker, state law substitution tracking, for a very complex area. So what we've built is a biosimilar information hub into our ordering platform. What this does is it gains access to all of our business units and the folks that are going in and placing orders directly through our pharmacy ordering system. And so they have access to biosimilar one-on-one, some infographics to help educate their patients. There's some education on what biosimilars are and how to implement the strategy in a pharmacy. We have our pipeline report in there. And then we also get into an interactive dashboard that talks about each state and the interchangeability laws. Again, just really trying to hone in on when pharmacists and providers have questions, they have kind of a one-stop shop to say, okay, why do I start this conversation and how do I educate myself? The other piece that we have in there is an indication tracker that looks at the innovator products and the biosimilars, and next to each other show, what indications are covered by those products. So for Brian and I, it's working with our manufacturing partners to make sure AmerisourceBergen has access to the product. But a huge passion of ours is educating the market and making sure that everyone feels comfortable with not only what biosimilars are, but how to have conversations with patients to make sure that they're also comfortable with biosimilars.
Before we end, is there anything else you'd like to add? And also, how do people find these resources? Are they on your website?
Yeah. So a lot of the resources can be at AmerisourceBergen.com, and we have a dedicated page there for biosimilars. That's also where you can find our biosimilar information hub and sign up for continuous updates there. Really, I just wanted to say on behalf of AmerisourceBergen and the biosimilar team here, we really appreciate all that you and the AAM team do. There's a lot of folks that need additional education, and having a platform to continue to learn, as well as to help educate ourselves, is very, very helpful, and we're grateful for all of that. AmerisourceBergen is dedicated to the success of biosimilars. We want to continue to help our manufacturers understand and grow, be a catalyst for their questions, be available to help them grow, but really help our downstream customers, pharmacists, providers, and patients also understand, learn, grow, and be a way to ask questions so that the biosimilar adoption continue to grow. So again, extremely grateful and thank you for all that you do every single day. And we look forward to doing more of these in the future.
Thanks again, both Brian and Connor and AmerisourceBergen for kind of sharing all this information. I think it's going to be really helpful for everyone during Global Biosimilars Week, and looking forward to our continued conversation and working together on educating and building more awareness about biosimilar medicine. So thank you very much, and hope to see you soon. Have a great day, great week.
Thank you very much.
Thank you.